Dear persons on the dais, friends here, I am grateful to the organizers of this national symposium, those who have given me this topic, which in fact is all different from what others have talked. I have no financial disclosure regarding this topic or otherwise. I think why not to do a practice? I put a little picture here. I think if you have a love or a passion for teaching and learning, and you want to see these kind of stalwarts, these are all my ROP trained. They work in different places, Bangalore, Calcutta, other part of country, and you enjoy that, and you enjoy doing research and writing papers, and you get that pleasure, the greatest satisfaction out of that, then probably you may not really like to go in for a practice. Of course, like I work for a public hospital, the government institution. You have a stability that may work for many, may think it is a rehabilitation place, and no risk is involved. You have a balanced lifestyle. You may come home in time, so make your family happy. You may have a totally assured career ladder to hold various positions, including many of us have desired to become professors, even otherwise. Many of us want to add that thing, or a chair of the department, or so I think you can fulfill that. You don't need a financial capital, so you have a support of hospital administration. This could be both for, I'm talking of public as well as some of the other bigger institutions which have come up. The biggest thing is, this is what is another draw for you, that you are accessible to the entire population rather than a selected group. I always tell, as a practitioner, maximum you can treat 10 to 15% of the population, not the entire population. They will never be able to afford you or come to you and think of coming to you. So that's what is there. I have put up these pictures here. You have some of these great people just by my side, and I'm fortunate to get associated with them. But they have drawn main satisfaction from the intellectual pursuits. And these are the people, that is what you can spend also. You can spend more time in the lab, in teaching, as well as probably doing also patient care, but you can divide that, which may not be possible once you are totally into a private practice. So passion in any of these areas can be pursued, and that will result in many of these people, those who are shown there, having publication right from Nature to Lancet to New England Journal, Ophthalmology, American Journal, and that is what gives them a big this thing, which is the biggest take, and that's how that keep them going in that direction. I think an issue is interaction with other departments. That is the only way it broadens your knowledge. How you get to know other colleagues, other specialties, and have collaborative work. Then the most difficult cases, the challenging cases with multiple problems, at the terminal stage, the most last stage, what we call, they'll come to you. They'll not be tackled anywhere in the practice. They'll be handled only in such a situation. So you can do more innovative studies, and the research even in such cases would be possible. There are drawbacks. One is financial crunch remains. You have a much less autonomy. There may be a lot of red tape involving even getting a simple thing sometime. You just need even the simplest thing, maybe some syringes or some bottles. You may be stuck forever. Hospital may put your most important demand, especially in ophthalmology, in a big hospital, as a last priority. So it happen. You may keep on convincing them, they may not get convinced. So what are the drawbacks I see in private practice? Most of the time, private practice could be exclusively for profit, but may not be so all the time. May have conflicting priorities, and the non-revenue generating position or equipment will be discouraged always. That will never be taken. Even if there is a retina person, he wants a OCT, they won't get it. They will get probably another phaco or a laser, or maybe other things. They'll be all right. And there is a lot of stress associated with investment and loans. Money may become the main goal because of these reasons. And the patient management may be influenced by the revenue. This is the biggest issue, in fact, in today's time. There is tendency to indulge in over-investigation and treatment even when not warranted. This is like a malady in our country for all specialties. You get isolated in private practice. Learning is limited to the practical aspects. Most of the time, they don't go much deeper. You have no peers available for advice or criticism. That is a big advantage. I can walk into my Professor Gupta's room. I have a difficult situation. I have anything, and that can be sorted out. And we have so many other people, younger people. Private practice may become over a period of time monotonous. You are doing one procedure, you're like a technician. So you have nothing to look forward to. And of course, you might have a job insecurity and fear of failure. The problems in both I see as there are negative comments from both academic medicine as well as both sides. This is a problem. Academic doctor does have sometimes more attitude than the private. And they might be insulting both ways. Sometimes the private doctor feels that he is in government because he is totally incompetent. And it could be vice versa. So there are these things keep on happening. And the unethical practices may happen in both areas as far as both are concerned. There are positives in both. Both academic medicine and private practitioners are complementary. Both have wonderful ophthalmologists who have broadened and update. They broaden their knowledge regularly, and they do better patient care, teaching, as Dr. Vasavara has just now shown, and research even in a practice. Both practice the art and science to the best of their ability. Here I have two of my friends here with me. One works for a public hospital, another absolutely a private organization. They both probably do the same, so both can be complementing and doing the same. So in the end, I would like to say what should be done. Why you want to go to practice or not practice is plan future according to which environment is best suit your personality. As I already said, what do you want to do? Where do you get your maximum satisfaction? Because that is what is going to make you happy in the long run. Your philosophy of life and the lifestyle you want to live. If you really want a high-end lifestyle, then probably you have to go to practice. There's no other solution. At the end of the day, if main satisfaction is drawn from intellectual pursuits and academic challenges, do not enter practice. That is where I'm going to end. Thank you, ladies and gentlemen.